Good evening, it's 8 o'clock. The top headlines tonight. After using monoclonal antibodies, 2 patients are recovered and discharged in a day, says Delhi's top hospital, Gangaram, that they were recovered within 12 hours, that this could be a game changer if used at the right time. After Scindia, now Jitin Prasada of the Congress updates his status to the BJP. For the BJP, they get a Brahmin face and an ex-Congress minister, part earlier of Team Rahul, before Uttar Pradesh's elections 2022. The Congress, however, attacks Jitin Prasada for his ideology shift. Also warns Sachin Pilot that you've been rewarded, be patient. Meanwhile, Sachin Pilot says he's sad at Jitin Prasada's exit. Milind Deora also tweets that he's saddened. But now, will BJP leader Mukul Roy do a ghar wapsi to the Trinamool Congress? Speculation rises as he skips a key BJP meet today. He says no decision right now as his wife is seriously ill. But this even as a former Trinamool, now BJP MLA Suvendu Adhikari meets the PM in Delhi. Mumbai's monsoon is here with extremely heavy rainfall, waterlogging, disruptions. But luckily, at least someone is enjoying the rain. Film star Varun Dhawan. The Made in India vaccine, Covaxin, is the 3rd costliest globally. Meanwhile, Bharat Biotech says phase 3 results will be public by July. Rising fuel prices, petrol is now at 102 rupees per litre in Mumbai. This as the Sensex today drops by over 300 points. And NDTV exclusive, Angelina Jolie's shout out to India and to all our frontline healthcare workers. Well, our big headline tonight, of course, is the monoclonal antibodies and the results coming from a Delhi hospital. But let's just look at the latest numbers. Well, the good news is India has less than 1 lakh daily cases for the second day. Our cases were up, however, 7% from yesterday. Deaths in the last 24 hours are also around the 2,000 mark, again up 3.5%. Remember, the day earlier than that was, of course, tests were lower. Tests up 6%, again from a lower base. The positivity rate, here's good news, is 4.67%. So that's below 10% for 15 consecutive days and below 5% for the last 3 days. Vaccinations, now that's bad news because that's down 17% as well. Now, of course, let's go across to Vishnu because now the pricing is out for vaccines in private hospitals, and there's been some controversy over the pricing of Covaxin, Vishnu.
Well, Sonia, pricing lies at the core of vaccination availability around the world, and while no one begrudges a pharma company a profit, when is it right to start wondering if a company is making a profit or profiteering? If you take a look at this chart, and let's have that up full frame for a moment, then in rupee prices, Sinopharm is the most expensive. It's a Chinese vaccine, followed by Pfizer, followed by Covaxin. This, of course, is not the price to the government. This is the price to hospitals, private players in the country, which has been capped by the government. But, you know, when it comes to an Atmanirbhar solution, the fact of the matter is that this may be Atmanirbhar, but it is certainly expensive. And the reason I say this is, why don't we compare it with some of the other vaccines we make in India now? The Universal Immunization Program procurement of pentavalent vaccines this year will be at the price of 17 rupees 37 paise for Serum Institute and Biologic E. Just think about it. These are complicated. 17 rupees 37 paise, and this was how much? More than 1200 rupees. Another example, the price of measles vaccine supplied by Serum Institute to UNICEF, which is also a live vaccine, 39.6 US cents, that's 30 rupees a dose. Therefore, a price of 1200 rupees for the inactivated COVID vaccine is very high, particularly since the government was also a partner in having organized trials. But it's difficult to say. A company can say, look, we have incurred these huge costs, huge facilities. We will never know because it is opaque. Will there be an audit? I think
that's the point, which is that we need transparency in pricing and costs. For what reason is the pricing, especially if the government is capping prices? So why should it be the 3 vaccines with 3 different prices. But meanwhile, let's move to what really is the big headline, the good news of the day. And could monoclonal antibody therapy actually be a game changer? Well, a top Delhi hospital, Gangaram Hospital, has said that 2 patients were recovered and discharged within 12 hours after they used this. Joining me this evening is the doctor in charge, Dr. Khosla of Gangaram Hospital. So, Dr. Khosla, tell us about this. Is really fascinating. 2 different patients, different age groups, different parameters, but both out of Gangaram within 12 hours. Tell us about it.
So the first case was of a 36-year-old healthcare worker. He presented with high-grade fever for 4 days, and he had a lot of constitutional symptoms. He had severe fatigue, weakness, body ache, and his blood parameters, his counts were low. They were 2600. His CT already started showing changes. So it looked as if he's going to have an aggressive disease. So we decided that this is the right time when we should target this with the monoclonal antibodies, since they are available now. We saw a dramatic improvement. So within like 6 to 8 hours, the counts improved to 5,400. His fever settled, the mild ears and all the discomfort, and the cough also started improving.
So that was a 36-year-old patient, but also you saw this dramatic recovery in an 80-year-old patient as well.
I'm going to discuss each case. So this patient we discharged within like less than 12 hours. The other is an elderly man, 80-year-old. He was a known hypertensive, found to be diabetic in the hospital, and he presented with high-grade fever on the 5th day. And along with fever, on the second day of admission, his oxygen started dipping a little. And when we decided, although he had a very good antibody levels, they were 720. So we decided his look is toxic and this is the best window. He is a very high-risk patient. If the disease on the 4th day is already showing changes, so we decided to give him this cocktail on the 5th day, and he also showed dramatic improvement. His oxygen was 98 within a couple of hours. We haven't discharged him as yet. This was given yesterday. We're just keeping him a day extra because he's 88.
Yes.
We would like to, all his parameters till now, they are doing good.
That's great news. And we have Anup Razdan, who's actually the son of Mr. R.K. Razdan. That 80-year-old patient is doing much better. Anup, thanks for joining us. Have you seen when you heard of this dramatic improvement, as Dr. Khosla just told us, what was your first reaction, especially given the fact that your father would have been a high-risk patient because of his age and comorbidities?
Yeah, when Dr. Khosla called me, like it took me some time to just understand what's happening, and then I knew a little bit about the monoclonal antibodies, and I think they're really definitely. I knew I've been reading about them, and I came to know. I was very sure that the benefits definitely outweigh the outcome of the disease than the risk. So he was 80 and he's 80 and it's a definitely a high risk case. So I thought I have to take a call on this, and being in the safe hands of an excellent doctors like Dr. Pooja and Dr. Dhiren Gupta, who were initially handling and who were very, very keen on calling me again and again and trying to convince me that it's very important and we should go for it. He is the perfect patient, and he can have a cytokine storm on the 6th and 7th day. So this is 1 or 2 days window period that one can give him these monoclonal antibodies, and I had to take a call. It took me some time, but then because I trust these doctors and they've been doing a fantastic job.
No, that is really wonderful to hear.
And he's recuperating very well, so I'm quite happy for the time being. So we are observing him. So far everything is fine.
No, but that's really wonderful, because it's so rare that, sometimes when you hear that patients actually start deteriorating so rapidly in the second wave. So,
that was the thing, because looking at his age, now he's around 80 and he is immunosuppressed a little bit because he's my father. I know him much more. So he has had some fungal problems in the last 8-9 years. So I was very reluctant to give him steroids. So this was one thing which really made me take the decision, because they said the use of steroids is almost, you don't need to use steroids.
No, and it's wonderful to see the changes that are coming. But Dr. Khosla, just to ask, I mean, of course, the questions, one is about the availability of it. We know it's available in some Delhi big hospitals, but how fast can it be actually given to hospitals across the country? And the cost is still quite prohibitive. So again, how do we make something which could be a life-saving drug like this accessible to many, many more people? What would you like to say today?
In terms of the disease has been playing around, and we have had lots of mortalities, and families have been wiped out. So the last wave was a bad experience. So this monoclonal antibody, it has come as a pleasant change, because one, the most important factors, to control COVID, we are using steroids. And steroids come with a very heavy price. You, after giving steroids, you are actually immunosuppressing your patient, and you are making them prone to a whole lot of infections, which include bacterial, fungal, and reactivation of certain viral diseases like cytomegalovirus and so many other things. And moreover, you are letting the COVID happen. Once COVID happens, there's a clotting phase, and there's an inflammatory phase, and then because of the therapy, there's an infection phase. And it doesn't end in 2 weeks. It carries on for weeks for most of the patients. So the cost, as compared to the quality of life and the complications and the drugs which are needed, it is not much. Yes, I understand.
No, in fact, I think that's a very important point, because those are the key costs. The cost, of course, there's no cost to a human life, which is the key thing. And when patients go on ventilators, when they reach that stage, we know the bills that run up in an ICU. So it really is something which can be a game changer. I hope that more and more hospitals can actually use this, which has been cleared now, by our drugs authorities as well. Thank you so much, Dr. Khosla and Anup Razdan. It's great to hear some success stories after all the tragic stories we've heard in the last months. Thank you very much. Moving now to other news. Well, the big political headline came as a Congress leader from Uttar Pradesh, a former minister and someone who was formerly close to Rahul Gandhi, Jitin Prasada, has now switched to the BJP. He switched just 6 months before the Uttar Pradesh elections. He is, of course, a key Brahmin leader in Uttar Pradesh, though, of course, in the Congress, there hasn't really been many successes for him. But the BJP clearly thinks that this will help in caste equations for them 6 months before the assembly elections. And for the Congress, of course, the bigger worry is this comes after exodus of other leaders, the most high profile of whom was Jyotiraditya Scindia. Today, Jitin Prasada met Amit Shah and tweeted about why he left the Congress to join the BJP in his press conference as well.
जिस दल में मैं था, मुझे ये महसूस होने लगा, अगर आप अपने लोगों के हितों की रक्षा नहीं कर सकते, उनके लिए काम नहीं आ सकते, तो आपका राजनीति और दल से में रहने में क्या औचित्य?
आदरणीय पीयूष गोयल जी,
Among the first words by Jitin Prasada, moments after he became the latest Congress neta to cross over to the BJP, ending months of will he, won't he speculation, in attendance was Minister Piyush Goyal.
जब जितिन जी कुछ बातें कहते हैं कि मैं पिछले 10 साल से सोच रहा था, तो आप 10 साल से कब सोच रहे थे? जब आप सरकार में मंत्री थे? दुर्भाग्य है कि जब देश कोरोना की महामारी से जूझ रहा है, क्योंकि इस महामारी के कुप्रबंधन के चलते लोगों की मौतें हुई है। और कुप्रबंधन किससे हुआ है? उत्तर प्रदेश की सरकार से हुआ है, योगी सरकार से हुआ है। कुप्रबंधन नरेंद्र मोदी जी के नेतृत्व में या नेतृत्व विहीनता में हुआ है।
Just 5 months ago, this was Jitin's tweet attacking the BJP government in UP for reportedly manhandling his friend and fellow Doon School alumni Rahul Gandhi during a march in the Hathras rape case.
जो जितिन प्रसाद हैं, वो कांग्रेसी थे और हमेशा रहेंगे, पहली बात तो ये।
But now the tune has changed.
अगर आज कोई इस देश में असली माने में कोई राजनीतिक दल है, जो संस्थागत इंस्टीट्यूशनल दल है, वो भारतीय जनता पार्टी है। इस देश हित में कोई दल और कोई नेता मजबूती के साथ खड़ा है देश हित में, तो भारतीय जनता पार्टी और प्रधानमंत्री नरेंद्र मोदी जी हैं।
For the BJP, Prasada ticks many boxes. For one, he is the latest young Turk and Rahul loyalist to break away after Scindia fueling speculation of more to follow.
प्रधानमंत्री नरेंद्र मोदी जी के नेतृत्व में गृह मंत्री अमित शाह जी और राष्ट्रीय अध्यक्ष नड्डा जी के नेतृत्व में आगे अग्रसर हो रही है। उसी पार्टी की मुख्य धारा में मेरे छोटे भाई आज जितिन भी आए हैं। मैं उनको बहुत बहुत बधाई देना चाहता हूँ और अपने तरफ से उनका तहे दिल से स्वागत।
Just days ago, the Congress's Sachin Pilot, locked in a long-running turf war with his Rajasthan rival Ashok Gehlot, once again expressed his unhappiness over the absence of a solution. In fact, right up until Prasada crossed over, Sachin Pilot was a top Twitter trend.
He is a member of the Congress party, a committed soldier. I'm sure the leadership will take care of his aspirations like it has. He has been suitably rewarded. He was one of the youngest members to be elected, one of the youngest ministers, one of the youngest deputy chief ministers. He's been on record to say that, some issues still need to be resolved.
Prasada has been the Congress's Brahmin face in poll-bound UP, even launching a pro-Brahmin caste outfit. His entry is meant to help the BJP reset the optics of the Yogi Adityanath government, perceived by a section of the UP Brahmins as being pro-Thakur, the Yogi's caste. But others question Prasada's relevance. He has lost 3 elections on the trot, 2 Lok Sabha polls in 2014 and 2019, and the Uttar Pradesh Assembly polls in 2017. He headed the disastrous Congress's campaign in this year's West Bengal Assembly polls. His Brahmin outfit, observers say, barely made a dent. Each high-profile exit only underscores the crisis within the Congress party and a wake-up call to the Congress leadership to be seen as taking corrective measures within the Congress party and pulling up its socks to ensure that it remains relevant and a formidable opposition. With camera person Gauri Prasad, Sunil Prabhu, NDTV.
But going across to West Bengal, where large-scale defections on the Trinamool may actually have backfired for the BJP before assembly elections in Bengal. And a BJP leader, Mukul Roy, who was, of course, formerly in the Trinamool, has now added to the party's nervousness by skipping a key meeting of the BJP today amid speculation that he is now contemplating a ghar wapsi to the Trinamool Congress.
The BJP Shubhendu Adhikari in Delhi to meet the Prime Minister as the party counters moves for a ghar wapsi. Several TMC turncoats want to return to the TMC after the BJP's recent loss in the West Bengal election. The biggest name amongst them is Mukul Roy, who skipped a key meeting of the BJP in Kolkata yesterday. BJP State President Dilip Ghosh said he couldn't attend on account of his wife's illness. Sources close to Mukul Roy say he's miffed after being overlooked by the party for the leader of the opposition post, which went to Shubhendu Adhikari. In fact, TMC General Secretary and the Chief Minister's nephew Abhishek Banerjee met Mukul Roy on 3rd June at the hospital where his wife is admitted. The next day, the Prime Minister also called Roy. Another leader who left the TMC soon after Mukul Roy blamed the BJP's strategy for the loss in Bengal.
Honorable our Prime Minister, Honorable our Home Minister, Amit Shah ji and JP Nadda Sahib. They cannot be the CM of West Bengal, everybody knows. So state CM has to be a face in Bengal where Mamata Banerjee is a established face.
Rajiv Banerjee, former TMC minister who switched sides before the election, also hit out at the BJP for opposing Mamata with the threat of president's rule after she won, in his words, a huge victory with public support.
যাদের মেরুদণ্ড নেই তারা চিন্তা ভাবনা করবে তৃণমূল কংগ্রেসের কাছে গিয়ে আর কুকুরের মতো থাকতে। আমি এটাকে পছন্দ করি না। আমার মনে হয় বাংলার মানুষ এইবার তার জবাব দিয়ে দিয়েছে। কোনো দলবদলুকে বাংলার মানুষ সাপোর্ট করেনি।
किसी को देरी से समझ आता है, किसी को जल्दी समझ आता है और आम इंसान के भलाई के लिए ममता बनर्जी काम कर रहे हैं। ये वो आगे भी जानते थे, अभी भी जान रहे हैं, मगर बीच में महसूस करना बंद कर दिए थे।
Soumitra Khan and Arjun Singh, also imports from the Trinamool, are in the national capital for a meeting with BJP President JP Nadda. Shubhendu Adhikari, one of the most high-profile imports who was appointed leader of opposition in Bengal, has ruffled feathers too by getting the job and old-timers in the party being ignored.
मैं गृह मंत्री से लेकर नड्डा जी से लेकर रेस्पेक्टेड प्राइम मिनिस्टर तक ये हालत का बारे में मेरा जो बोलने का मौका था मैं बोला। ऑल इंडिया बीजेपी बंगाल की कार्यकर्ता का साथ ये अत्याचार बंद करने के लिए जो 42 हमारा वर्कर्स का निधन हुआ, मर्डर हुआ, उसके ऊपर उसका साथ বিচার দিলানে के लिए हम लोग कमिटेड है।
শুভেন্দুকে নিলেই সরকার পাল্টি করা যায় না, তাই এখন যারা তার নেতা বা যারা এখন তার বস তারা যাতে রেগে না যায় সেই জন্য বারবার গিয়ে তাদের স্যাটিসফাই করার চেষ্টা করে।
Mamata Banerjee's hat-trick and her emphatic win against the BJP in West Bengal means that the BJP will have to sit in opposition in the state for the next 5 years. Those who joined the BJP thinking it was coming to power are now looking for other options, including returning to the Trinamool. And this thought of Gharwapsi has become a challenge for the BJP in West Bengal. In Kolkata with camera person G.D. Shankar, Saurabh Gupta, NDTV.
Well, the other big headline, the good news, of course, is that Mumbai cases continue to drop. But as the monsoon hit Mumbai today, a few days early, it was a red level alert with extremely high rainfall across the city. Transport services disrupted as well. This, of course, as the city has just begun unlocking. A red level alert here in Mumbai tomorrow, and also on Friday and Saturday, a red level warning for Orissa, and an orange alert in Mumbai after tomorrow as well. So heavy rain and many complaints that, well, the BMC has done nothing about the waterlogging. But here's someone enjoying the rain. Bollywood star Varun Dhawan tweeting shirtless pictures of him saying the rain, the monsoon is finally here. Quick look at other news. Well, petrol prices continue to be on fire, diesel as well. Petrol is now at 102 rupees per litre in Mumbai and above the 106 rupees per litre mark in Ganganagar in Rajasthan. Or in Chennai as well, diesel has crossed 91 rupees. Let's go across to the markets today. Well, the Sensex had a bad day, down by over 300 points. Also at the Nifty, numbers down as well. The main reason dragged by Reliance Industries and financial stocks there. So major dip at the markets. Well, Angelina Jolie, Hollywood stars exclusively on NDTV on a new movie where she stars as a firefighter in Those Who Wish Me Dead. But speaking to NDTV's Rohit Khilnani, she talked also of India's frontline workers and the amazing job they've done in the recent second wave.
Angelina, you guys play firefighters here. Any message to all those who are watching, who are firefighters, frontline workers? I'm from India. We're going through a crazy wave of pandemic still. So any word for them?
Well, I would certainly say to everyone, to the people of India, we're all with a very heavy heart, and there's really no words to express the grief, solidarity, for all that the people of India are suffering.
Don't miss that. But of course, we end with our focus on people doing amazing work. And imagine if just a single WhatsApp message could help get you vaccinated. Well, if you are a senior citizen, then that is really all it will take. All thanks to the Robin Hood Army.
These Robins, or volunteers from the Robin Hood Army, have brought a group of senior citizens to a vaccination center in Gurugram. There are over 1 lakh such volunteers spread out across 210 cities in India who are just one WhatsApp message away for a senior citizen who wants vaccination or even food and medication. From Ajmer and Aurangabad to Silchar, Surat and Trishur, the Robin Hood Army's WhatsApp chatbot, launched less than a month ago, has helped more than 1,200 senior citizens get vaccinated. You will be picked up, taken to the center, escorted through the whole process and then dropped home.
WhatsApp has always been our lifeline because there's coordination required between thousands of volunteers. Coordination for food distribution, coordination for food pickups, coordination for our social media announcements. Now what we've done is, in partnership with WhatsApp, we have introduced this chatbot, and this makes the process of joining RHA or putting in a request for senior patrol much simpler. Earlier, you had to go to the website and register yourself, which might not be that simple or that easy for everybody, right? So now we have a number, we have a WhatsApp number. You just drop a text onto that number and it will give you the options that like what all can you do? Do you want to register as a volunteer? Do you want to donate food? Or do you want to put in a senior patrol request? Then it asks you for your city, name, email, phone number, like all the relevant details, and the registration happens. So the idea is that this should increase the number of volunteers that join us, obviously because the process has been made much simpler. And because of that, we should be able to serve thousands of more people.
The Robin Hood Army is a zero funds volunteer organization that started in 2014 with the aim of collecting excess food from restaurants and the community to serve less fortunate people. In 7 years, the RHA has distributed 17 million meals without raising a single rupee. When the lockdown started last year, the Robin Hood Army launched a senior patrol to provide senior citizens with basic needs, medicines and groceries. And now Senior Patrol 2, which is seeing a higher number of sign-ups and volunteer registrations with the introduction of the WhatsApp chatbot, and which has helped a number of senior citizens when they have been at their most vulnerable. So pick up your phone and send that message. The Robin Hood Army is here to help.
Amazing work being done there. That's it for now on the news.